time, we're back. This time we're going to look at optimal immune system, how to achieve it. Keeping our immune system up is huge. There's actually physicians that have a hypothesis. It hasn't been proved yet, but I know scientific brothers. So their hypothesis is for allergies, if we can have a high immune system, that may be the best way to reverse allergies. They believe that allergies are due to a compromised immune system. So as we look at things like a common cold, the flu, whatever it might be, keeping that immune system up is very, very important. Well, what about cancer? Is the immune system good for that? Keeping cancer away? Sure. Yeah. And so as we pull down the immune system, we're more prone to different health issues. And so that's what we're going to talk about, how to improve, have optimal immunity. So number one, let's see here. What's the immune system? We'll look at that. We'll look at things not to do, things to do. What kind of things could we take supplementally to build our immune system? Immune system distinguishes self from non-self and eliminates potential harmful non-self molecules and cells from the body. Immune system also has the capacity to recognize and destroy abnormal cells that derive from host tissues. Any molecule capable of being recognized by the immune system is considered an antigen. The skin, cornea, and mucosa of the respiratory and gastrointestinal tract form a physical barrier that is the body's first line of defense. Some of these barriers also have active immune functions. We're actually told what organ of the body has the most effect on your immune system.
What is cornea?
The cornea in the eye. And what organ has the most impact on your gut? What percent? You say 80? Could be. They say at least 75. So it could be 80. Yes. A very high percentage of your immune system depends on gut health. Very, very important. Things not to do. Here's the top three. Number one, sugar. Now, who has the book Proof Positive? Excellent book. I encourage everyone to have that book or have a resource to it. Dr. Neil Nedley. And in that book, Neil says that if you take a typical soft drink, a 12-ounce soft drink, Dr. Pepper, Mountain Dew, Coca-Cola, what is the soft drink of this region that people drink? Don't know? That's a good thing. Yeah, okay. What do you see people buying at the store?
Yeah.
Coca-Cola. Okay, Coca-Cola. Headquarters of Coca-Cola is in Atlanta, Georgia. It started in Alabama. It's where in a pharmacy in Alabama. Mountain Dew, have you ever heard of Mountain Dew? Well, that started in Knoxville, Tennessee. The mountains, the Appalachian Mountains, the dew, that's where it came from. So Neil Nedley found that a 12-ounce soft drink, when you drink that soft drink, it will wipe out your immune system 50% for the next 4 hours. 50%. Now let's say that you add, y'all have Snickers bars here? Let's say you add the little Snickers bar, like when we were kids. Not the ones today, but the little ones, like this. Y'all remember those? Those used to be in our school lunchbox. Neil says that if you take the 12-ounce soft drink and you take the Snicker bars this size, it will wipe out your immune system. Only 1 out of 14 white cells are going to work for the next 4 hours. You just anesthetized 13 white cells for 4 hours. And that is just a 12-ounce. A milkshake, the average milkshake. Or maybe, how about this one? It's just
the average slice of cheesecake. Those two wipe out the immune system, Neil says 92 to 93% for the next 4 hours. Amazing, isn't it? Now, when I was in regular healthcare, I did a lot of educating, going around teaching and doing things. And on the way to meetings or places I was going to teach or different things I was doing on the road, I would pull into a gas station, and I never liked coffee, just never liked it. I tried it in high school and college to try to stay up to study, and I just didn't like it. It tastes nasty to me. But I like Dr. Pepper, and I like Snickers bars. So what I'd do is I'd pull into a gas station, get me a Dr. Pepper to get my energy going to the trip, get me a Snickers bar, and I'd eat that on the way to the meeting. Now, what happened to my immune system when I was there, when I got there? It was down 50% from whatever it was. But when I got there, usually you'd walk in the door and right over here would be some tables. And what would they have on them? Danishes, right? And you'd pick you up a Danish or two. And you'd walk over and say, you'd find old Homer and Sally and shake their hand and see them. And let's say Homer had a cold and he had a runny nose. And right before he shook his hand, he went, and you went and shook his hand. And then you went and you finished eating on your Danish. What just happened? Did I just transfer anything? And where's my immune system? Less than 50%. Now I'm eating the Danish. See how I got sick? It's real simple. So sugar is huge and wiping out your immune system. Stress. And we'll talk about stress in a few moments. I'm a little more in depth into stress. But if you want to wipe out your immune system, just get stressed. Have you ever just got a phone call and something just tore you up real bad? Y'all use that word, tore up? Okay. Not tearing up paper, but just tore you up inside, and you're all upset, and you wonder why you got sick the next day? That's what happened. You just wiped out your immune system with that stress, and we'll talk about that in a minute. Number 3, sleep deprivation. Sleep deprivation. And Harvard University says, and we'll find out in a minute how much stress wipes out your immune system, but Harvard says that sleep deprivation, you'll wipe out your immune system as much as stress. So have you ever not got your sleep and get sick? Yeah, that's my problem. That's my biggest enemy, because I'll get a phone call. I get toned out and I head down the mountain and I get on the interstate. I'm working a bad wreck or I'm working a house fire. And a house fire doesn't last just, an hour. I want to make sure nobody's in it. I'm going through everything. I want to make sure it doesn't start again. I do not like rekindles. Rekindles aren't an option. And so I'm going through, I take my glove off and I'm testing where there was fire. I do not want to rekindle. I've got a thermal imaging camera, but I trust my hand more than I do the thermal imaging camera. If anything, I can see major hot, but I'm checking it, and I'm there, Mary Lou, no, I might be there 6 to 8 hours on a house fire, because I want to make sure nobody's in it somewhere. But I do not want to rekindle. Just don't want it. Then I have to investigate. What's the origin of that fire? I'm looking for flame spread. I'm looking at the electrical system. We know that most fires come from in the kitchen in the United States. But in my region, and where I fight fires, most of our fires are from electrical. That's usually what it is. It's electrical problems. And so we're having problems with electrical. And so I'm having to check the electrical system. So I'm out all night. What if it's cold? Not only do I lower my immune system because I've stayed up and didn't get my sleep, but then I got to be at work. But if it's cold and rainy, like the other night before I came here, that wreck I told you about that run off the side of the mountain, it was cold. I was sopping wet. But you got to take care of these people. And I got a cruddy, something going on in my chest because my immune system was dumped because I was out late at night, not getting my sleep. I was in an environment that made me more prone to get sick. Sleep deprivation is huge. Sugar. Besides being a driver behind other chronic health conditions like diabetes and heart disease, sugar consumption affects one's body's ability to fight off viruses or other infections in the body. White blood cells, also known as killer cells, are highly affected by sugar consumption, and we just talked about that. Sugar hinders the immune system by not allowing the white blood cells to do their job and destroy bacteria or viruses, as well as when we do not eat sugar. Now, I'm giving American statistics here. The average American consumes approximately 42 teaspoons of sugar a day. Can you imagine her going and taking 42 teaspoons of sugar? How many? 22? I do an example sometimes with a kid when I do this. I'll take a glass and I'll put in water and I'll say, "Are you okay with your child drinking water?" Absolutely. And then I have the child come up and we take, let's see here, I'm going to put 12 teaspoons of sugar in there. No, I'm sorry, 10 teaspoons of sugar. 10 teaspoons of sugar. Stir it up and I say, "Mom, can she drink this?" No, but it's got water. Water's good for her. But why not? And then I'll pull out a Coca-Cola or Dr. Pepper and I'll say, "That's how much is in here. 10 teaspoons of sugar in a 12-ounce Coca-Cola." And we just don't correlate that. We just don't do that. 10 teaspoons of sugar in a Coca-Cola. But a lot of our kids are drinking far more than just one can of soft drink a day. They're drinking gulps. As the guy I told you about the other day, he came in for diabetes and he was doing 3 liters of Mountain Dew a day. 3 liters. Think about the sugar. 150 pounds of sugar per year and 79 pounds of high fructose corn syrup. Do y'all have high fructose corn syrup here? Yes? Yes. It's in bread. It's in ketchup. It's in sweet pickles. It's in, yeah. It's pardon? Sure. It's poison. Yeah. High fructose corn syrup is bad stuff. And it lowers your immune system. Stress. Many of today's illnesses and diseases are triggered by chronic stress, which depresses the immune system and wreaks havoc on every organ in the system of the body. Psychology today. Stress. Exactly how stress causes and contributes to disease is a question of particular interest to researchers. There are 2 likely pathways. One is behavioral. People under stress sleep poorly and are less likely to exercise, and they adopt poor eating habits. Smoke more and don't comply with medical treatment. Stress also triggers a response by the body's endocrine system, which releases hormones that influence multiple other biological systems, including the immune system. This is interesting. 1 minute of anger can suppress your immune system for 6 hours. And Neil has this in, I don't remember, I think it's proof positive this is in. So my friend that I've talked about, the neurologist, he and I were speaking in front of a group of people, actually doing this lecture in front of a group of folks a couple years ago. And his specialty is neurology in the brain, the nerve system in the brain, in improving brain function, especially with dementia. And I said, "Neil, help me out physiologically." 1 minute of anger can suppress your immune system for 6 hours. I said, "Let's talk physiology. Is there a difference in 1 minute of anger or 1 minute of major stress physiologically. He said, nope. I said, so I could then say 1 minute of stress can suppress your immune system for 6 hours? He says, yes, that is true. So do you ever have major stress? Maybe you're a person who never gets angry. Or maybe you do sometimes. So whether it's anger or major stress, you just wiped out your immune system significantly for how long? Longer than sugar. Now we can't have sugar, but we can get stressed. Or we can have a little anger, and that's okay. But it's healthy anger. You wipe out your immune system. Sleep. Sleep provides essential support to the immune system. Getting sufficient hours of high-quality sleep enables a well-balanced immune defense that features strong innate and adaptive immunity and less severe allergic reactions. Sleep's huge. Lack of sleep can affect your immune system. Studies show that people who don't get quality sleep, what do you mean quality of sleep? You get enough sleep. Enough is you need 8 hours. Quality means, are you waking up all night? Are you waking up to go to the bathroom 7 times because you have prostate issues? Or lady, you waking up and you just can't go back to sleep because you're worrying about the kids or the grandkids? Or the lady next door? Or somebody you might be worrying about. Studies show that people who don't get quality sleep or enough sleep are more likely to get sick after being exposed to a virus, such as a common cold virus. Lack of sleep can also affect how fast you recover if you do get sleep. So if you do get, pardon? Pardon? Oh, thank you. It gets sick, yes. So is sleep important? Yeah. It is, yes. So here's things not to do. Sugar, stress, sleep deprivation, a poor diet, vitamin D deficiency, drinking alcohol, obesity, smoking, dehydration. And look at that last one, internet addiction. Can internet addiction affect your immune system? It sure can. Have y'all done anything with Scott Redsmith's information? You know Scott Redsmith? Great. Yeah, great program. Media on the Mind, Media on the Brain. Excellent information. Good research. So let's look at poor diet. Diets that are limited in variety and low in nutrition. Limited in variety. Remember, we say we want a whole food, plant-based diet with variety. And so what's it saying here? Diets which are limited in variety and low in nutrients, such as consisting primarily of ultra-processed foods, can negatively affect the healthy immune system. It is also believed that a Western diet high in refined sugar and red meat and low in fruits and vegetables can promote disturbances in healthy intestinal microorganisms, resulting in chronic inflammation in the gut and associated suppressed immunity, just as you said earlier. It's the gut. We've got to keep the gut healthy. And that poor diet can affect the gut health. The poor gut health can affect your immune system. Vitamin D deficiency. Deficiency in vitamin D is associated with increased autoimmunity and an increased susceptibility to infection. Research shows that vitamin D plays an important role in immune function, and a deficiency in it, vitamin D, is shown to increase one's susceptibility to infection. Vitamin D deficiencies can mean your immune system is more vulnerable. Low levels of vitamin D have been associated with frequent infections. In a 2009 National Institute of Health, in 2009, NIH warned that low vitamin D levels are associated with frequent colds and influenza. And the key here on vitamin D is not how much vitamin D you're taking. I don't think I've told you all this yet. Had a lady come in, she is Caucasian, and there's a difference. Did I talk about this? There's a difference in our skin color based on what sunshine does regarding our vitamin D. Dr. Irvin Davis, a black physician in South Alabama, South Georgia. He works in Alabama some at UT Pine. But I took him to Africa last time, and as we were teaching physicians and nutritionists and different folks, he said, our skin, his and their skin, has sunglasses on it. He said it takes 6 times the sunshine for us to get the same amount of vitamin D as it does Walt to get vitamin D from sunshine. 6 times more for the darker the pigments of the sun. So this lady comes in, she's Caucasian, so that means she's got skin like mine. She works in landscaping all year round, so that means she's outside all the time. She takes 5,000 IUs of vitamin D. And I have a friend who's a physician, says, Walt, you never need more than that. Nobody needs more than that. And her vitamin D level is 12. Now, normal level of vitamin D is 30 to 100, according to the lab. But Dr. Khanna, the guy I talked about, who specializes in brain function, he doesn't want his patients less than 60. And Dr. Watkins up in DC, for your immune system and for bone health, he doesn't want it below 80. And here this lady had a 12, and she was taking 5,000 IUs a day. So for 3 months, we went with 5,000 twice a day. It only went to 17. So then I called Watkins up in DC, does a lot of work with vitamin D. He said, Walt, let's go 20,000 twice a day. So we went 20,000 twice a day. That's 40,000 a day. We did that for 3 months, and it only went to 24. What it turned out was she had a magnesium deficiency. And a magnesium deficiency can affect your vitamin D absorption. So it's not how much you take of vitamin D. It's not how much you're outside. What is your blood level? That's the key. What is your blood level? Alcohol compromises the body's immune system and increases the risk of adverse health outcomes, World Health Organization. Alcohol can trigger inflammation in the gut. Again, we're going back to the gut again, and destroy the microorganisms that live in the intestines and maintain immune health system. And maintain immune health system health. There we go. Obesity. Obesity, like other states of malnutrition. Now, how are you obese? You must eat a lot of food to get obese. How are you malnourished? When I get people that are 400, especially 450 pounds and up, and I sit down and I do a history, and I ask them, what do you eat for breakfast? What do you eat for dinner? What do you eat for supper? What do you eat in between meals? They're mostly eating chips, soft drinks, hot dogs, hamburgers, pizza. That's pretty well what they're telling me. Sometimes I'm hearing ice cream, but those are the big issues that I'm hearing. Those are what's called empty calories. And so they're eating calories, but they're not getting nutrients. So they're malnourished in nutrients because they're eating empty calories, which empty calories is food high in calories, but it's empty in nutrients. Obesity, like other states of malnutrition, is known to impair the immune function, altering leukocyte counts as well as cell-mediated immune responses. Smoking. Smoking harms the immune system and can make the body less successful at fighting disease. We can have children at 1 year old smoking. We have children at 6 months old smoking. We can have children the day they're born smoking. How? Secondhand smoke and side stream smoke. Secondhand smoke is what mom blows out. Side stream smoke is what's coming off the cigarette. How many kids smoke in the car with the windows up? Mary Lou did. She smoked in the car her whole time growing up. Her daddy smoked. And so Mary Lou smoked until she was what?
I just breathe the smoke.
But you still smoked. I smoke houses. I try to go in with an air pack, but I smoke houses. I breathe the smoke from house fires. Is it good for my lungs? Probably not. I started firefighting 42 years ago. And I can tell you that the chemicals in house fires today are much more toxic than 42 years ago. And so, does that affect my lungs? It does. Dehydration. Significant positive correlations were found between severity of dehydration and changes in the ratio. This is this immune stuff, so I won't go into that. But it definitely affects your immune system. Dehydration, these results suggest that dehydration results in immunosuppression, including decreased neutrophil function. Are we getting hydrated here? Can that actually dehydrate us there? Why? Caffeine. Caffeine's a diuretic. So actually you're drinking the Pepsi, but now you're not taking Lasix, but you're taking caffeine, which is a diuretic, and you're actually getting more dehydrated. You can't count the volume of fluids, because the volume of fluids might be, as the old timers would tell me, can I count my moonshine? I don't get that as much anymore. They'll say, it's got water in it. No, you can't count your moonshine. Let's go to internet addiction. Can damage immune function. People with excessive internet use have 30% more colds and flu symptoms than those with less problematic internet usage. 30% more colds and flus. Those who spend excessive time on the internet tend to have, let's look at root cause, greater sleep deprivation, because they just can't put it down. Worse eating habits, because they just don't go eat, they just stay on the internet. They might be just eating chips. And less healthy diet. Engage in less exercise. Tend to smoke and drink alcohol more. Do those affect the immune system? Yes. Things not to do. Let's look at things to do. Number 1, prayer. World Health Organization recommendations, healthy diet, and hydrotherapy. Prayer. I encourage you to read Psalms 91. We won't read that right now. It's homework. And Psalms 103. Very important. I encourage everyone who has stress, a lot of stress, to read Proverbs, a chapter in Proverbs a day. That's a good one. The next things to do, World Health Organization, WHO. Wash your hands regularly with soap and water, alcohol rub if not visible. And it's true, as we mentioned, that some pathogens are killed by soap, some pathogens are killed by alcohol. And so sometimes washing with both can be more effective if you're not sure exactly what you have. So washing hands can be very important, but you can wash your hands too often. Practice respiratory hygiene. Cover your nose and mouth when you're coughing. Throw the tissue into the closed bin. Wash your hands. What did we used to do before? We've had Kleenexes a long time, but as I grew up, my father, my grandfather had what in their pocket? A handkerchief. And you got a little snotty-nosed grandkid, and he goes, here, blow your nose. Sally, blow your nose too. And then granddad goes, sticks it in the pocket. Remember those days? We remember those days. And what did we just do? Pass all that stuff around to each other. Yeah. Handkerchiefs are best used for crying, not dealing with your nose. Use a tissue, throw it away, wash your hands. That can be important. Maintain social distancing. It's interesting, prior to COVID, WHO recommended only 1 meter. 2 meters came only with COVID. Actually, when COVID started, at first, WHO only recommended 1 meter. Avoid touching your eyes, mouth, and nose. Why? They're holes. Holes into your body. Can you get pathogens into your eye when you touch? Your nose, mouth? It's holes to get into your system. Mask and personal protective equipment. This is what WHO recommended. If you're sick, when caring for someone who is sick in a healthcare setting. If you're unwell, stay at home. If you have a fever, cough, or difficult breathing, seek early medical care of whatever you choose there. Diet, a balanced diet consisting of a range of vitamins and minerals most effectively primes the body to fight infection and disease. Eating enough nutrients as part of a varied diet is required for health and function of all cells, including the immune system. Hydrotherapy. We're not going to go into hydrotherapy. We'll do that next week, but just to mention here that hydrotherapy can affect the immune system. Using hot and cold contrast showers, bathing, or fomentations can powerfully optimize the immune function and greatly stimulate antibody production against viral and other forms of infections. Finish with a cold shower after your shower, and that will increase your immune system. I can always tell when Mary Lou takes a cold shower. She's hollering downstairs. Dr. Schultz says if you're not hollering, it isn't cold enough. Things to take. Let's take a look at these real quickly. Vitamin D. Vitamin D helps our immune system stay balanced during the cold and flu season and serve as a pharmacy rescue. There are vitamin D receptors and activating enzymes on the surface of all white blood cells. If you have a good vitamin D level, say 90, do you need to take vitamin D pills, supplements? No, you have enough. The role of vitamin D plays in keeping the immune system healthy is very complex because the immune system has to be perfectly balanced. If there is too much stimulation, autoimmune disease can set in. If there's not enough immune system activity, frequent infections can occur. Garlic. Allicin is an active ingredient of garlic. It has antibacterial, antifungal, antiviral, antiprotozoal activity. So when you eat your garlic, remember the other day when you handed me the garlic, and what did I do? I put the spoon on it and I smashed it. What smashing it does is it's like taking an epoxy and putting two chemicals together. And when you smash it, it then activates the allicin. And so you want to smash your garlic and then eat it. Allicin exhibits various biological properties like antimicrobial, anti-cancer, antioxidant, immunomodulatory, my tongue tied now, anti-inflammatory, hypoglycemic, and cardiovascular effects. Garlic is extremely good for the immune system. Garlic appears to enhance the function of the immune system by stimulating certain cells, like cell types such as macrophages, lymphocytes, natural killer cells, NK cells, dendrite cells, and eosinophils by mechanisms including modulating of cytokine secretion, immunoglobulin production, phagocytosis, and macrophage activation. I'm getting tongue-tied. Onions, very similar to garlic. Onion is an immune-boosting food rich in fructans. Are onions good to add to your food?
Yes.
Absolutely. Onions are huge. A lady told Mary Lou before she met me, she was a missionary over in Pohnpei, and she said, if you want to keep a husband happy, when he gets home, just have some onions sauteing. It smells good, don't it? It does. Yeah, it smells like home. Onions are very good for us. Oil of oregano. Oil of oregano is a big friend of mine. Oil of oregano is like a 44 Magnum. It's good. Oil of oregano is a powerful plant-derived essential oil that may rival antibiotics when it comes to treating or preventing various infections. And this is from a journal, a medical journal. Oil of oregano. If you take oil of oregano, do not use just straight oil of oregano if you're going to put it straight in your mouth. You want to mix it, 25% oil of oregano, 75% olive oil. It cuts it. It's like doing a carrier oil. It cuts it. It's hot. It's going to burn you. And so it's going to burn your mouth. It's going to burn your esophagus. It's going to burn your stomach. So if you mix it with that carrier oil, olive oil, just like it's not going to burn your skin when we use carrier oils, you don't want to use oil of oregano neat in the mouth. And so you use the carrier oil, olive oil. Oregano oil contains properties that are antibacterial, antiviral, and antifungal. Again, zinc is very important for the immune system, and us males are more prone to lose zinc than females. Zinc is a mineral that's important to the body in many ways. Zinc keeps the immune system strong, helps heal wounds, and supports normal growth. It's very important for the thyroid function. Vitamin C. Vitamin C is one of the largest immune system boosters of all. In fact, a lack of vitamin C can even make you more prone to getting sick. Just being low in it can make you prone to get sick. Foods rich in vitamin C, guava, kiwi fruit. I went to a seminar one time by the dietitian for the United States Navy SEALs. So she ought to be pretty good. SEALs are pretty good. And she said that there is more vitamin C in the cap of a strawberry than a whole orange. Isn't that amazing? So she said, when you make your smoothies, let's say you put 6 or 8 strawberries in your smoothie, throw them in with the caps in it, because you're getting a lot of vitamin C. Guava, kiwi fruit, oranges, broccoli, kale. Daily intake of vitamin C is essential for good health because your body doesn't produce or store it. Cleveland Clinic. Again, remember, vitamin C has a half-life of 30 minutes. Yes?
What's the strawberry cap?
Oh, okay. You've got your strawberry and the little green cap on top that we cap off and throw away. That's it. Isn't that amazing? Yeah, thank you. And again, remember, vitamin C has a half-life of 30 minutes. So if you take a vitamin C pill and you think, well, that's going to do me for the day, it'll do you for 30 minutes. Good. So I like 6 times a day if you're ailing, or y'all know what ailing is, if you're sick, or if somebody in the house is sick, 6 times a day. If you want to hit it hard, go to bowel tolerance. Bowel tolerance is when you get a loose stool. We call it green apple 2-step. What happens when you eat too many green apples? It gives you the 2-step. So what happens is if you take 30,000 and it gives you a loose stool, go down to 10%, so 27,000. Divide the 27,000 by 6, and that's how much you take 6 times a day. B6. B6 is vital to supporting biochemical reactions in the immune system. B6 is found in green vegetables, in chickpeas. B6 is also very important for your nerve function. B6 is huge for nerves. Vitamin E. Vitamin E is a powerful antioxidant that helps the body fight off infection. Foods rich in vitamin E include nuts, seeds, and spinach. Elderberry, we talked about that the other day, inhibits the early stages of an infection by blocking key viral proteins responsible for both viral attachment and entry into the host cells. Very important. Phytochemicals from the elderberry juice were shown to be effective in stopping the virus infecting the cells. However, the surprise of the researchers, they were even more effective at inhibiting viral propagation at later stages of the influenza cycle when the cell had already been infected with the virus. I apologize, I'm going fast. And this is from University of Sydney. This observation was quite surprising and rather significant because blocking the viral cycle at several stages has a higher chance of inhibiting the viral infection. So growing elderberry, and you say that we can grow elderberry here. Put you some elderberry plants out. Mrs. White put out elderberry plants where she lived. And grow your elderberries, collect your elderberries. Mountain women where I'm from, they would take the elderberries and either make an elderberry syrup, or they would take and put them in little baggies, put them in the freezer, If somebody got sick, they pull them out of the freezer and make an elderberry tea. So it's real simple there. Astragalus is very, very good. The broad array of immune stimulating characteristics of astragalus has been widely used in treating patients with both acute and chronic infections, including viral myocarditis and viral hepatitis. Myocarditis is inflammation in the heart. Echinacea. Echinacea preparations are commonly given in Europe for the prophylactic or treatment of bacteria and viral infections and as an adjunct to treatment of more severe infections. Echinacea extracts are commonly used to treat upper respiratory infections, influenza-like infections, and are reported to significantly reduce the symptoms accompanying the common cold. Now, here's the thing on echinacea. You want it to, just like golden seal, no more than 2 weeks because you lose efficacy. You don't have the problems of depression like you do golden seal, overuse, but you'll just lose efficacy. So you may want to go 2 weeks golden seal, 2 weeks echinacea, 2 weeks golden if you want longer term. Iodine is very important. Iodine, natural antiviral, antifungal, antibiotic. Iodine was the most effective agent for killing viruses, especially influenza viruses. Aerosol iodine was found to kill viruses in spray mists, and solutions of iodine were equally effective. And you don't have to be just spray. You can just take the pill by mouth. NAC, we're familiar with NAC. Very important. We learned a lot about NAC during COVID. And then we'll finish on rocket fuel. We had rocket fuel the other day, remember that? Rocket fuel, 5 to 10 cloves of garlic, half an onion, a thumb of ginger. If you don't have a thumb, we did a tablespoon of ginger here. Lemon juice of 2 lemons, honey, 2 tablespoons, cayenne pepper, 1/8 to half a teaspoon. I put a tablespoon of elderberry. I put a tablespoon of Alimed, add warm water to net 1 quart, blend, drink all in 30 to 60 minutes. This is the original rocket fuel that I got. I've added these 2 here. Any questions? Immune system. Yes, sir.
You were speaking about alcohol. There usually about every other year, there's a study where it says drinking a glass of wine a day is good. How would you address that?
That's a good question. It's still alcohol. It still addresses brain cells. You know, it's not good for the brain cells. Alcohol still affects people who do even, you still can have liver issues. You still have people that if they just don't have the ability to say just one, I don't recommend any. Yeah. If you're looking for the resveratrol, like in wine, that they say is good for us, drinking 1 glass of wine a day, they're after the resveratrol, which is good for the heart. You can get resveratrol out of a glass of Concord grape juice. And that's, you get the same thing. And you don't have the propensity. I think you're flirting with fire when you drink alcohol. And there's no question. Alcohol affects the liver, alcohol affects the brain, and to me, it's a poison to the body. Yes, sir.
And there is also no declaration on the bottle. No declaration at all. And that's unique for food, actually.
One of the other reasons that alcohol can affect your immune system, it's sugar. It has sugar. And so sugar can lower the immune system. Yeah. One more? Okay, yes.
Why can't you just take the grape juice instead?
For resveratrol. Resveratrol is a big reason some will say you need to drink the glass of wine. Resveratrol is a chemical that helps with heart health. And so they say, drink the wine to get the resveratrol.
Because it's alcohol in it?
No, it's in the grape. But the grape does not have to be fermented. It can be and the grape juice, Concord grape juice, unfermented. And you still get the benefit for the heart. And so it's not fermented that way. Any other question? All right. Well, oh, yes.
Rocket fuel here, is that for preventive
Both.
or is that for treatment? And
Yes.
if for preventive, how often now? One per day or?
Well, definitely I wouldn't do more than one a day. That should be plenty. If you have sickness in the family, everybody could drink it. Or if you have sickness that you know that's around and you want to just keep your immune, you could do one a day. That was done in China to prevent, they were doing this part here, the original rocket fuel. They were doing that in homes to prevent coronavirus proactively. Yes.
In the beginning of the presentation, we were talking about sugar. Sugar kills the white cells, right?
It doesn't kill them. What it does is it puts blinders on it. It anesthetizes them, or anesthetizing them. And so it puts them asleep for about 4 hours. So it doesn't kill the white cells.
Okay, so my question is, the juice, the juices from fruit can make that same effect because of the fructose?
The fructose.
Or
Yes.
okay.
Yes. I'm not saying we shouldn't drink fruit juice. And what you have to look at is if you drink a glass of apple juice, is that 1 apple? 2 apples? It's a bunch of apples. When you normally eat apples, how many apples do you normally eat? 1 apple. It's kind of like nuts. When we eat nuts, we have people who eat a whole bag of nuts. But do you remember, I don't know if you do this in Sweden, but when I was a boy, and it was Thanksgiving, and we would sit there as the ladies were fixing Thanksgiving dinner. The men were sitting around talking, and they were cracking nuts, and they'd eat a nut. And if you're cracking your nut, do you eat a mess of nuts, a lot of nuts? No. I think God put hard shells around nuts so it'd slow us down eating them, where we didn't pick them off like tomatoes. So the same true here is when we eat the fruit, and I'm not saying we shouldn't drink fruit juice at all. I like fruit juice, but we want to use it in moderation. But definitely, if I'm sick, I'm not going to drink the fruit juice. The other day, my son, I offered him some fruit juice. He goes, no, his wife wasn't feeling, or one of his kids wasn't feeling well. And he did not want to go home into that environment and lower his immune system with a sick child. And so he would not drink the fruit juice.
So when drinking fruit juice, should you dilute it with water to avoid the high sugar?
Well, the volume is there. So if you dilute it with water and you're still drinking that whole amount, you're still getting that much fructose. So if you pour a half a glass and you're only getting half the volume of juice, and then you want to still have volume of, a liter, you add water, then you're fine. But if you put in, say, a half a liter, and then you pour in more, you're still getting a half a liter. Okay. Well, y'all, let's close with prayer. Dear Heavenly Father, Lord, we're still trying to learn here. We're still asking questions, and that's good. Lord, keep providing us information. Why the importance of sprouting our food, for juicing, for keeping a good immune system, and how we can keep a good immune system. And we can use as an entering wedge to share your Son's love and care in the gospel with them. We ask this in Jesus' name. Amen.